My name is Carmela. This is Luke, and we came here today to get the 32-week pregnancy adjustment.
I'm Shannon Riche, and I'm here today to have a pregnancy check with Dr. Hardick.
We definitely take care of a lot of pregnant females in the office. We definitely see consistently that when women do take care of their spines, when they receive chiropractic care through their pregnancy, that they consistently report that they're not having a lot of the just complications and just health challenges, even the aches and pains that a lot of their other friends do when they've gone through pregnancies. A lot of the pregnant females that come in to see us, they're not coming in because their back hurts. They're coming in because they want to be healthy, they want to be strong, and they want to have good nerve communication from their brain through their spinal cord out through the nerves that exit the lumbar spine that control their organs of reproduction.
Well, I'm 32 weeks pregnant. I was at my obstetrician's 2 days ago, and she said that the baby's head is still up, so it has not turned. And I know the procedure that, or the adjustment that Dr. Hardick would like to do today should encourage the baby to turn. That's what we're hoping for.
So I'm just over 31 weeks pregnant, so I came to make sure that the baby's head is down, so giving birth will be hopefully easier. Probably not pain-free, but easier.
The good side is that, with her coming, she really doesn't have any pain or anything. I mean, it's really helped out.
So my name's Jordan, and this is my baby Lenny. When I was 34 weeks pregnant, I think, maybe 32. Anyways, late in my third trimester, I was at my midwife's, and they felt the baby, and they told me that they thought that she was breech. I spoke to my doula and explained the situation, and she recommended BJ to me because she said that she heard that he turned lots of breech babies by the Webster technique. So I called him up and I came in that day.
As it relates to in-utero constraint, one of the major things I recommend for moms when they're at about week 32 is that we do a special checkup on them. So when I went to school in Atlanta back in the 90s, I studied before his death under Dr. Larry Webster, who was really known as the grandfather of chiropractic pediatrics. And it was through his anecdotal studies and working with so many pregnant women that he saw that if there was a twisting of the pelvis, the key time to check a mom for a subluxation or a misalignment of the pelvis that could actually interfere with the baby's ability to naturally turn was week 32. So one thing that I recommend for all moms, if they're just getting checked through their pregnancy, is that we would keep an eye on their spine, look at the level of the pelvis, make sure the spine is in good alignment, and do that throughout the entire pregnancy. But at week 32, we do a real special check. And it's interesting, we can follow a couple spinal landmarks, measure down to where that trigger point will be. We'll palpate in there, meaning get my thumb on there, and moms can feel it because they feel this giant knot that correlates with where their sacrum is misaligned as well. So Dr. Webster saw that well over 90% of the time, if a mom got checked at week 32 and had some twisting of the pelvis, and if he gave the right type of adjustment, which would go on to be called the Webster technique, that the baby would turn. So what's really exciting is in my 15 years, I see the same thing, and I've worked with, dozens, if not hundreds of moms that have come into the office where the baby maybe hasn't turned, even all the way up to week 35 and week 36, looking to say, hey, how can we relieve stress on the pelvis because they want to avoid having a C-section. And actually there are cases sometimes where doctors will go in and try and internally turn the baby. And of course, if you can do it safely and a lot more comfortably for the mom by giving a gentle adjustment of the pelvis, it's not about forcing the baby to move to a different position. It's really about taking the stress off the pelvis so that the baby can naturally turn on the baby's own.
So head is still up here. And
this is our third child, and I'd had some difficulty with my previous pregnancy in terms of my back discomfort, sciatic pain. I kind of anticipated that it would be very difficult this pregnancy in terms of some of the pain, the back pain, that it might continue or become even worse. But having come every week to see Dr. Hardick, I'm finding I have a lot more comfort in my body. I was able to work right till the end of June. I'm a teacher.
I knew that if I didn't get the baby turned, then I would have to try and find an obstetrician who would deliver a breech baby vaginally, and I wouldn't be able to have my midwives. So I was pretty stressed out about it. I really wanted to make sure that everything was okay and just would go as normal.
If this clears out real nicely, next visits we'll check up here. Or frankly, if it's still week 32 and a half, 33, 34, we keep checking that. But in all honesty, I can't recall a time that we had to use the Webster technique where the baby wasn't turning on schedule.
Okay.
I had an appointment scheduled for Wednesday anyways to come back. Wednesday morning I had my ultrasound to confirm where the baby was, and the baby was head down after my adjustment. And that was ideal, yes.